A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a dramatic showdown at the Centers for Disease Control and Prevention (CDC), Director Susan Monarez has firmly rejected calls from Health Secretary Robert F. Kennedy Jr. to resign, igniting a significant political controversy just weeks after her appointment. Monarez, who was confirmed as CDC director only a month ago, has found herself at the center of a fierce clash over vaccine policies and the direction of public health in the United States. The conflict escalated publicly on Wednesday when 4 senior officials at the CDC resigned in protest, expressing their frustration over the recent changes in leadership and vaccine directives. This mass resignation underscores deep divisions within the agency and raises concerns about the future of public health policy under the current administration. Monarez's lawyers have stated that she will not step down, emphasizing that her commitment to protecting public health stands in stark contrast to what they describe as a politically driven agenda from the White House. When CDC Director Susan Monarez refused to rubber-stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that, she has been targeted, said her attorneys, Mark Zaid and Abbe Lowell. The tensions came to a head as Monarez resisted demands from Kennedy and his deputy, Stephanie Speer, to endorse sweeping changes to COVID vaccine policy, which they argue are necessary to align with the administration's goals. The White House responded to Monarez's refusal to resign by officially terminating her from her position, claiming that her unwillingness to support the president's health agenda justified their decision. White House spokesperson Defies stated, "Since Susan Monarez refused to resign despite informing HHS leadership of her intent to do so, the White House has terminated Monarez from her position with the CDC." However, Monarez's legal team countered that, as she was appointed by former President Donald Trump and confirmed by the Senate, only Trump has the authority to dismiss her. They have notified the White House counsel of their position, insisting that Monarez remains the CDC director. The unfolding drama over Monarez's leadership comes at a time when the Biden administration is facing increasing scrutiny over its handling of the COVID-19 pandemic and vaccine distribution. Recent changes to vaccine policy, overseen by Kennedy, have already limited access to updated COVID vaccines, now only available to seniors and high-risk individuals, a significant departure from previous guidelines. The FDA's decision to narrow the vaccination criteria has sparked backlash from public health experts and advocates who argue that it undermines efforts to combat the virus effectively. In light of the political turmoil, for high-ranking officials at the CDC, including Chief Medical Officer Deb Ouster, submitted their resignations, citing the ongoing politicization of public health as a primary reason for their departure. In an email to colleagues, Ouster expressed her dismay at the changes, stating, "I am committed to protecting the public's health, but the ongoing changes prevent me from continuing in my job as a leader of the agency. This is a heartbreaking decision that I make with a heavy heart." The resignations of Ouster, Dan Jernigan, Demetra Daskalakis, and Jennifer Layden signal a troubling trend within the CDC, where career officials are increasingly feeling pressured to conform to political directives rather than adhere to scientific evidence. Daskalakis, who also resigned, remarked, "I am not able to serve in this role any longer because of the ongoing weaponizing of public health." The fallout from this confrontation raises serious questions about the future of the CDC and its ability to operate independently from political influence. As the agency grapples with the implications of these leadership changes, public health experts warn that the integrity of the CDC's mission to safeguard the nation's health is at stake. The Biden administration's approach to public health, particularly in the context of the ongoing pandemic, will be closely scrutinized in the coming weeks as the political landscape continues to evolve. As the situation develops, it remains to be seen how the Biden administration will navigate these challenges and what impact this internal strife will have on public health initiatives moving forward. The CDC's role in managing the COVID-19 pandemic has been critical, and any further disruptions to its leadership could hinder efforts to combat the virus effectively. With public confidence in health authorities already shaken, the administration must work diligently to restore trust and ensure that public health decisions are guided by science rather than politics. In the meantime, the political ramifications of this conflict are likely to reverberate throughout the upcoming election cycle, as both parties seek to position themselves on healthcare issues. The handling of the pandemic and vaccine distribution will undoubtedly be a focal point for voters, and the Biden administration's ability to address these challenges will be crucial in shaping public perception and electoral outcomes. As we move forward, the question remains: how will the Biden administration reconcile the demands of political leadership with the imperative of protecting public health? That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.